Hello everyone, it's a great pleasure to be here, and I would like to present our latest study around the 330-300 green space rule and mental health that we conducted in Barcelona. I'm J Nieuwenhuijsen. I work for the Barcelona Global Health Institute, and my main interest is around green space and health research. Cities are great places to live, but there are also hotspots of air pollution, noise, heat island effects, and the lack of green space, in particular in compact cities like Barcelona. We see that there is not much green space around, but we know that green space is good for health. We know that there is a relationship between how you design cities, how people get around, how they experience the cities, and how this leads to morbidity and premature mortality. Green space is one of the factors that's important in urban design, and we encourage cities to plant or introduce more green space. A few years ago, we wrote a review on green space and health. And in the review, we identified many health benefits from green space, in particular longer life expectancy, fewer mental health problems, better cognitive functioning, better mood, healthier babies, mitigation of air pollution, heat and noise levels, and also some CO2 sequestration. And we suggested that replacing roads and parking with green environments would could turn a city or an environment that's currently unhealthy for people to healthy environment. Now, only the question is, how much green do you actually need? And that's still one of the questions that is out there. Often when we think about green space, we think about a lovely park like this, but there are not so many cities that actually have this kind of parks. And of course, there is also other green space around. Recently, Professor Cecil Konijnendijk, an urban forester, came up with the so-called 330-300 rule of thumb for urban forestry and urban greening. This was just, meant to be a rule of thumb to help city planners with green space. I mean, he suggested that every citizen should be able to see at least 3 trees of a decent size from the window from their home, have 30% tree canopy cover in their neighborhood, and live not further away than 300 meters from a major park or green space. He suggested that they have health benefits, but it hasn't been tested yet. So our aim was to see if you would apply this 330-300 green space rule, if it would be related to, say, better mental health. Therefore, we conducted a cross-sectional study using a population-based sample of over 3,000 individuals, adults from Barcelona who participated in the Barcelona Health Survey. We created this 330-300 green space indicators using questionnaire, GIS, remote sensing, and land cover maps. And we measured or obtained information on a number of indicators for mental health. We used logistic regression with adjustment for a number of different covariates to see if there was a relationship between the 330-300 indicators and this mental health indicator. The first thing what we found in our study was that actually very few people in our sample, and therefore the population of Barcelona, actually achieved this 330-300 rule. Only just under 5% actually had sufficient green space according to this rule. We found, though, if these people achieved this particular rule, if they had, could see 3 trees from the window at 30% tree canopy cover in their area, and they were living within a park of 300 meters, they did much better on the various indicators for mental health we had. We found a reduction between 23 and 76% reduction in this mental health indicators throughout the cohort. I mean, here you can see some of the numbers. They differed a little bit. For poor mental health, there was a 23% reduction, and that went up to about 76% for visits to psychologist or a psychiatrist. I mean, also what we saw, intake for medication for sleep and antidepressants actually was lower if you complied with this particular rule. So there is some indication that this rule actually may lead to better health benefits. I mean, but it's important to realize that this rule doesn't include if people actually go to visit green space, or also the quality and biodiversity of the green space. And both may be actually quite important also, and related to physical and mental health. If you would like to read a little bit more, the paper was just published in Environmental Research, providing also in great detail the methods. So it's time, I think, that we introduce more green space in our cities. Many cities actually lack green space, so there's a real need actually to introduce more. And the 330-300 rule that Professor Cecil Konijnendijk suggested may be a good target for our cities. Of course, it may be quite difficult in many cities, particularly in very compact cities where there is not so much space. But perhaps we need to take a bit of space away from the cars that we have in our cities and roll out our green to make it a much more pleasant environment. One of the examples that I would like to show you is this is Ramblas de Poblenou in Barcelona. I think that has many of these kind of measures what we're looking at. This is a pedestrian street, mainly pedestrian street with cycling lanes on the side and many trees there. Also, this is in a neighborhood where there are where people live, where there are many shops, and also where people work. So an ideal environment to walk around, enjoy the neighborhood, and also particularly in the summer, it's much cooler because of the trees compared to surrounding areas. Thank you so much. If you have any further questions, you're welcome to contact me on my email here below, and I'm happy to take any further questions. Thank you so much.